Our guest is Dr. Rand McClain, and Dr. McClain is a regenerative specialist, but he does it all, right? What we talk about in this episode a lot is stem cells. You're going to learn about the role that they play in regenerative medicine. We're going to talk about how stem cells are used to heal a variety of issues from chronic disease to concussions, how to prepare your body for stem cell treatments, what you can do today to change your health right now. Dr. McClain believes it's never too late to change your health. So you are definitely going to want to listen on these and many more gems. So a little bit about our guest is Dr. Rand McClain. He's kind of been one of those guys that's ever since he was a kid, he's been into nutrition and wellness. And his journey to become a leader, which is what he is right now in alternative and progressive medical treatments, has been anything but orthodox. He was the youngest senior account manager in Deloitte's history. That's right, like Deloitte, that's the consulting firm. Then he went on to become a professional boxer in Argentina. He was then accepted to med school at age 37 after so many people told him it was literally impossible. This guy clearly doesn't take no for an answer, and he is no fan of the status quo. So if you love this episode, you are absolutely going to want to get your hands on his latest book that just came out this month called Cheating Death. It is like a primer for how to optimize your life and health span, all the different regenerative treatments out there. He even talks about peptides in there. He's just a wealth of information. So where can you connect with Dr. McClain? He's got a great website, drrandmcclain.com. He also has another website, psrmed.com. And he's on Instagram under dr.randmcclain. And then at those places, you're going to find all the other places to find him. But guys, this book, Cheating Death, definitely a great read. It's a nice, easy, it's just an easy read. It was written for you and me so that we can get all the information that we're looking for in the least amount of time. And of course, you can always join the Optimizing Superhuman Performance group on Facebook. But just remember that we got to watch our language over there because there's people watching and listening, and they don't always love the topics that we talk about. So without a second more delay, let's get into the episode and meet Dr. Rand McClain. Enjoy. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the podcast, Dr. Rand McClain. It is such a pleasure to have you here today.
It's mine. Thank you for having me.
Yeah, no, this is exciting. I don't even know how. I think it's your team found me somehow. And when we looked you up, I was like, yes, this is the guy I want to talk to. And I was just,
well, that makes you feel good too. Yeah.
Yeah. Well, as I said to you before, like when I looked at the list of topics that were being offered up, I said to my assistant, I'm like, well, can't we talk about all of them? She said, no, you have to pick one, maybe two. I'm like, all right, fine. I'll pick one, maybe two. But maybe Rand will have such a good time with me that he'll offer to come back, and then we can talk about number 3 and 4.
Sure. Yeah. Well, let's see if I give you more than you want, and then you might not want me back. But yeah, we'll start with one and go from there, right?
All right. No, I think we're going to do just fine. Okay, so before we launch, how about we talk a little bit about you and what you do and why you do what you do, because you're in this space of regenerative medicine, which is, I think, a term that's been created by the people in your space because there was really nothing in medicine that really existed. Like, do they even teach regenerative medicine in med school at this point, or is that just a foreign concept?
No, in med school, that would definitely be considered a foreign concept. And you're right. It's a specialty that doesn't exist as an official specialty. The word has been invented, really, I think we started with the regenerative medicine for a while. And of course, before that was anti-aging medicine, and still is in some circles. But regenerative medicine, I think, catches it, better than most. And it is wide open. And, specialties in internal medicine, you could say, is somewhat wide open too, depending upon what aspects of internal medicine you're practicing. But with regenerative, there's not a specialty. And it is pretty wide open and will only be growing as we find more ways to improve health span, which is what regenerative medicine is essentially about.
Yeah. Yeah. So it's, yeah, I mean, which I love, because ultimately, as we talked about before the show, as I talk about very often with my guests, is we all, especially those of us, I'm kind of on the tail end of the baby boomer generation, and we want it all. Not only do we want to live a really long time, we have no plans of leaving this planet anytime soon, but we want to look good. We want to be able to climb mountains. We want to have our head together. We want to be able to, we want to live a full life for a very long. So we've really upped the ante, because I think, if you go back a little while, people were just like, well, I just don't want to die so young. And so people didn't want to die young. And it's almost like they asked the genie for the wrong thing. So the genie said, sure, you don't want to die young, no problem. And so now you have like these places filled with people who can't remember their names, can't wipe their own butts, like, stuck in a wheelchair, like living this really miserable existence. And so the rest of us kind of went, oh, wait, there's a better question to ask the genie.
You're right. And I would go so far as to say, without exception, really, and that's rare you can say that, without exception, everyone I've ever spoken to, at least in my office, but I would say outside too, would, if forced, to choose living shorter,
Yeah,
but of a higher quality than the other way around, hands down. No,
absolutely.
And the beauty of regenerative medicine right now is you don't have to make that trade, because all of the stuff that we're doing is improving your quality of life and also extending it at the same time. For example, if we're, improving sugar metabolism,
Mm-hmm.
you could argue that, your metabolic dysfunction is the key to pretty much the 5 major killers in the Western world these days, type 2 diabetes and coronary artery disease, et cetera. You're extending your life while improving it, because you get your blood sugars better, you feel better, you operate better, you function better, obviously. And you stave off type 2 diabetes, which tends to have, as does coronary artery disease and cancer, et cetera, tends to shorten your life too. So it's a win-win.
Yeah, and shortens your quality of life, right? Because just the type 2 diabetes and coronary disease will ultimately very often lead to some kind of cognitive decline or dementia or neurodegenerative disease, in some way, shape, or mechanistically, and we're exactly where we don't want to be. So those diseases of aging, if we can nip them in the bud or avoid them in the first place, I think it's job one, really.
Yeah, we're
But
finding out too that even if you don't start early on in life, uh, for example, we've done some studies showing that, if you don't start manipulating your blood sugars and other things that are manipulated by using, say, metformin, which is a diabetes drug that's been around forever, generally very, very safe, that if you start at 30, you're still going to get a huge benefit out of it. Somewhat like what we found out with, former smokers. As long as you stop smoking sooner rather than later, quit digging a hole,
yeah,
it fills back up that hole much sooner than, it's not linear, and you don't have to, I've been smoking for 30 years. It's going to take me 30 years to get back to a non-smoker state. No, it reverses fairly quickly. So that's another beauty of what we see coming, ahead, and currently in regenerative medicine, is that, there's hope. And we touched on this a little bit before we started talking on the podcast about, people thinking, I've already blown it. No, you haven't. Just
mm-hmm.
because you've been doing it for 30, 40 years doesn't mean you're sunk and might as well, live by the same sword, die by the sword and all that kind of stuff. Yeah, you can reverse a lot of things that you've done, as well as, by the way, I might add, reverse some of the things that you were born with. And that goes into, gene editing that we've developed, and all kinds of good stuff. So a lot of good news on the horizon here. Well, I say on the horizon currently, as well as on the horizon.
Yeah. So let's talk a little bit about that. Let's talk about, because I know that, we talk a lot about epigenetics, right? So you're born with a certain set of genes. And for the most part, unless there are certain genetic variants, obviously, that are going to set you up for a very bad outcome. But for the most part, these are switches that get switched on or off in many ways by some of the decisions that we make, whether it's lifestyle, how we manage our stress, the diet, like all of the different things. So, but you're talking here maybe about taking that a step further, and in some cases being able to modify genes so that they don't express. Do you want to expand on that a little bit?
Yeah, I'll use your analogy. It's a good one because the genome boils down to the switches that you inherit. Okay. And I like your analogy because then the epigenome is a reflection more of what you do with those switches. Some you switch on, some you switch off in a way that improves your quality of life, improves your health span, right? Uh, there's a field of study, I would give most of the credit to Steve Horvath, where
Hmm.
the methylation of these genes can turn them on or off, and lack thereof, or whether you methylate them, et cetera. And that's huge. What's a great upshot of that is, given that you've got this set of switches that you're born with, without any gene editing, and we can circle back to that in a second, you can still change. You can flip the switch on or off. Again, I'm gonna use your analogy from now on. It's a great one because
It's a good visual
the
for people.
yeah, no, it is. It's a pretty simple one too, but it's very accurate. Just because you flip the switch on or off doesn't mean you can't change that. And that's the beauty of medicine. And that's why we're looking for some of these, we call them aging markers.
Hmm.
There's what we call the biological age, which is a reflection of your health. And then there's, of course, the chronological age, which we can't change that. And DNA methylation is one of those. I would say no one would really argue that it's not a great biomarker for aging, because it's very, very close, very, very accurate. It's used to estimate. Nobody knows what your chronological age is. We give them your genome, and we can check for DNA methylation, and come very close to your age, oftentimes within a half a year, at most maybe a year and a half on average. And so we've got some ways to check this. And the beauty of that is we can apply some of the things that we know about, anti-aging devices, whether it's supplements or activities of daily living, cold baths. And I mean, there's a myriad of things, and that's the beauty of it too, that we can choose from, because maybe people don't like jumping in a finished lake that's 33
Hmm.
degrees. They prefer the heat, so you can use infrared sauna or something like that. But you can see with some of these markers whether they're working for you or not. If the switches which were off can now be turned on, and vice versa. So again, going back to the excitement going forward here, we've got a lot of options. And going back to gene editing, that's a step further, where here you have your window of opportunity, as it were, of switches. Well, if you've got a bad set, or some that are locked in the wrong position on or off, with gene editing, we can go back into the cells and say, into the DNA itself, and snip sometimes the ones, take out those switches and replace them with the switches we want. Or sometimes we don't necessarily have to remove the bad ones. We can add the good ones. So we've got options there. And that's being done as we speak.
Is it? And is it safe? Does it work? I mean, I'm sitting here going, I'm pretty open to pretty much anything. And I'm like, I don't know. Do I want somebody going in and messing with my DNA? And how do you,
Right.
like, which DNA, because we have DNA helixes in all of our cells.
Mm-hmm.
So how do you do that? How does that work?
Well, I'll say with the exception of red blood cells, but
Okay, yeah, but a
the,
lot of the
the,
cells.
we're going in, and we're finding that, starting with mapping out the genome, we're finding what's responsible for
Hmm.
what correlates with this official disease. Okay. We can also obviously, find out that there's more than one gene that affects this disease state, or this propensity, for example, coronary artery disease.
Right.
When it comes to uh, right now, typically a rare disorder, okay, because it helps us narrow it. We can say, okay, here are the different sets of genes and sequence that we can snip or replace, and we'll correct this rare disorder. Again, because it makes it easy to some degree, because we're not dealing with propensities for blue eyes or something like that,
Right.
which is more than one. And also, you've got people oftentimes that are unfortunately fairly desperate for a solution. Blue eyes versus brown eyes is not something that
No, this is not
That's
life
great.
threatening. No.
But that's where most of the testing is done right now. And we've got the carriers, we've got CRISPR is the most well known, but we've got different carriers, viruses that can take the requisite DNA where it needs to go, splice it in, take it out, and we've had some great success. Now we have had some setbacks where it didn't carry very well. And by the way, this is used also in immunology because we can treat, for example, certain cancers by splicing in the things we want and sending it to the certain cells we want, the cancer cells. But all in all, we've made huge strides forward. And of course, I mean, you smiled when we talked about it a little bit, and I can think of some of the things we talk about. Well, I want to make sure that I want to have the jumping ability of Michael Jordan. So if can we splice in some of his genes for his muscles or something like that? As great as that sounds, it's unfortunately a little bit more complicated than that. But we are doing some pretty weird things, actually very successfully, with glowing dogs. And you go, what? That's science fiction.
No, I read about that recently.
Okay, so you've read about it already. That's something I think proves that it works, but to what end, I don't know. Somebody's fancy of having just saying they can do it or whatever. But some of the more complicated cases haven't always worked out well, but the promise is there for sure.
Yeah, no, that's really interesting. I think the glowing dog thing was more of a proof of execution, right? Like it's hard, it's hard to show that you've changed let's say you've changed a gene for cardiovascular disease. You can make something glow in the dark. It's pretty impressive. That's not supposed to glow in the dark.
Well, and you know what, you bring something else up.
It's more like proof of concept than anything else.
Well, along those lines of a different concept, and stop me if I'm going too far afield here, but one of the cool things that we can do is that we can take tissue and we can take those genes that we know correlate, say, with a propensity for coronary artery disease formation or development, and instead of testing on Worcester rats, which that's a whole other subject of how it really probably doesn't even come close to representing us, not just because it's not human, but because it's a really strange form of rodent to begin with, and it doesn't really apply to the average American, or at least the average healthy one. But we can come up with, say, heart tissue, liver tissue, whatever it might be, and in a petri dish now study the effects of different drugs, and therefore really accelerate the process without having to test it on humans to see. I mean, you might have heard that certain people don't react to statins very well at all. It just doesn't work.
And even metformin, right? Even metformin, there's some people respond well to metformin and other people just don't.
Well, that gets even more complicated because certain cancers, although most react well to use of metformin, certain of them can be furthered, we find now. But these are things that we can all tease out in the lab, is what I'm getting at, using gene editing before we start testing on humans. And it really will accelerate the process so that we can say, oh, you have those genes? Great. We've already done the testing. We'll use this drug on you instead.
Yeah, no, it's fantastic. I think, just that piece alone, I know that I do some genomic testing for my clients, and I don't go a lot into the pharmacological aspect of it because I'm not a medical doctor. I don't want to sit and have certain conversations with people. But, even in the test that I run, like we can look at how fast do you metabolize anesthetic, for example. Like, how interesting would that be to know when you're going in for surgery that you're the kind of person that's going to need way more anesthetic or I don't know if it's quantity or type of anesthetic, but that your body's going to metabolize it much faster versus someone else where it's going to last a lot longer. And so maybe you would adjust the dose or you would use a different kind. I'm not an anesthesiologist, but how interesting that we can actually get this information from a person's genetics and save them some heartache and misery and fine tune medication to what they need.
Before you go down the wrong way, which could be actually hurtful, if not harmful, and save yourself the unnecessary gnashing of teeth that comes with choosing the wrong one and who happened to switch to a different one because you found out the hard way. That's exactly my point. Yeah, huge.
Yeah. All right. So Okay, so now we've gone down a rabbit hole we weren't even supposed to talk about. So let's get back to our track. And
I warned
so
you.
I know you did warn me, but as long as it's interesting, we're good. As long as it's good content, we're golden. And I think so far we've talked about super interesting stuff. So, I thought we were going to talk about stem cell therapies first, but you actually alluded to this other topic already. So let's go back to this and let's talk a little bit about that it's not too late. That even if, let's say, in your 20s and your 30s, maybe even to a degree in your 40s, you hadn't bought into this healthy lifestyle business, right? You were partying, you were drinking, you're smoking, you're eating the wrong foods, you're not really exercising, maybe you're not exercising at all, you're burning the candle at both ends. Assuming you survive those decades and you wake up one morning and you go, that's it. I'm puffy, I look horrible, I feel worse. Is it too late? Like, can I undo the damage? So can we talk a little bit about what is it that you're damaging? What are the things you can turn the clock back on? Is there a too late, or is there always time?
There's always time. That's an easy one to answer. And I would argue that it applies to most of us. I mean, what you just described is a lot of some people we might know fairly well as college life, except for the lack of exercise part, if you play a sport. But most of us overcome that. And what we're really talking about here, and it's a different angle than what we just talked about, is regeneration to counter degeneration. We've accelerated the degenerative process typically by drinking in excess, smoking, not exercising, not doing the right things when it comes to diet. And that's a pretty big one. I won't go too far afield there, but everyone's a little different there, as you well know. And then and not getting enough rest, which people tend to ignore since the invention of the light bulb, really, in the industrial world. So you got some pretty big things that affect pretty much everybody, and we can reverse or certainly slow the degenerative process using stem cells. I argue most of it, though, we can actually, if not fully stop, actually reverse the process. And that's the beauty. Now, some people will say, well, that's great. Well, then why can't we just, what was it? Benjamin
Button
or whatever.
Yeah,
Why can't we over
Benjamin Button.
Well, because being on the planet, by that very nature, we're always in that degenerative process. So it's not a one and done, and we can't go back that far, but we can certainly oppose the degeneration. And of course, some of this is not necessarily from drinking. Some of it's just like, for those of us that like sport, and like to compete, for example, which we now find is not necessarily the best thing for you.
No, it'll shorten your lifespan. Yeah.
Absolutely. And I remember seeing the first signs of that. I won't name his name, but one of the early marathoners and land speed record holders, I remember meeting him and he's one of my heroes and thinking, this guy's only 36. He looks like he's 63. And I don't mean that in a mean sense. I just remember it was an easy observation. There was too much oxidation going on, right? And not enough recovery, et cetera. Well, that can hit a lot of us too. And so part of my point, though, is that you can do stem cells till the cows come home, but if you're also working out and using those stem cells to further your competitive nature, et cetera, well, you got to find the balance. But stem cells are really, you refer to a genie. These are more like a genie than anything else, because you could argue a monkey could do it. Once you collect the cells, if that's what you're doing, or once you initiate their release from your own bone marrow, they know what to do. The stem cells, certainly your own, will engraft in the area that needs the work. So if you've just had, God forbid, an MI, a heart attack, and you've damaged some of your heart cells, the stem cells know to home in on that area and replace the damaged cells with the stem cells that then differentiate into heart muscle cells. What's contained in what we call the exosomes are very important. Also, in some of the other fluid, the tissues, you'll find, everyone knows about messenger RNA now since COVID, but it's been around longer than COVID. But those messenger RNA will go to the bone marrow and say, "Hey, works over here, guys. We've got damage. To use our example here, heart muscle. Come over here and replace it with some of our own cells that are created in the bone marrow, and then differentiate once they get to the heart muscle. That's amazing. I mean, I'm a nerd. I think this is super amazing. But even if you're not into science, didn't that sound amazing? I mean,
Yeah,
the
no,
body knows what
I'm
to
right
do.
with you. Yeah. Yeah.
Yeah.
No.
So that's what we have going on with stem cells now. And I'm happy to state that only recently, as a result of a lawsuit that I believe was brought by the FDA against Dr. Berman, who's taken a lot of the arrows, front and back, for those of us in the field that were like, wait a minute, the FDA is calling stem cells a drug?
Yeah, apparently, what was it? It was as soon as they pull them out of your body, now they become a drug, and now they're regulated by the FDA. I remember hearing this going, what?
Yeah, I know. And I don't mean to, and it's not just because I don't want to get grief from the FDA. It's really, I understand the idea of trying to protect the public. It's just they chose a way. I guess they were grabbing at whatever straws they could to try and regulate it, because there was some bad stuff going on with people with stem cells. But that happens in any industry. No excuse. You still want to try and control it. But I think they picked a way that just wasn't tenable. If you've got any mind for science, yeah, like you say, what? Those are a drug. Those are my cells. And the key words they used were, if you more than minimally manipulate those cells, then they become a drug. And we don't have to go into the details of it. The upshot of it is that the judge here in California, where the suit was filed, ruled in favor of Dr. Berman and said, in his findings of fact and conclusion of law, and it was actually written very brilliantly. You ask any attorney and they'll say, wow, that was really well written.
Nice.
The upshot is, hey, these are not drugs and we can use them. So as of the last month or so, and that's because the deadline passed after a month in which the FDA had time to appeal. And you'd think you'd hear more about it. I was just talking to someone in the business today about it. I was like, why isn't everyone jumping up and down and celebrating? But the bottom line is we can now use them in the United States like in so many other countries. At least that's the way I'm interpreting law. And I think this is going to be a huge boon for those of us that, could use the regeneration, which, per our earlier part of this conversation, I think applies to all of us.
Yeah, no kidding.
There are very few risks involved with certainly using your own cells. It would be more in the collection process, which I can talk about all you want, but also with umbilical cord tissue cells where it's somebody else's. As long as you go through the process of proper screening and third-party testing, very minimal risk there too, and only upside.
Yeah. So we've talked about a few different things of stem cells now. So let's dig into a few of them in order. So number one, you talked about stimulating the release of your own stem cells from the bone marrow. So this is the least invasive of the procedures. It's, and this is a natural mechanism in the human body, the natural mechanism of self-repair and self-regeneration, where we have a stash of stem cells in our bone marrow. It's sitting there waiting to be activated. We've got these chemical messengers that come along and say, there's been damage. You guys, we need your help. And so off they go. But there's things that stop that release of stem cell. Maybe there's at some point, I don't know if there's kind of a stem cell exhaustion thing that happens, but maybe we can talk a little bit about, and I'm sure as we age, we're not as able to mobilize those stem cells and send them out, because if we were, then we would just keep repairing, and that apparently isn't happening. So let's talk a little bit about that. And then from there, let's talk about the autologous stem cells, which are whether they're extracted from the bone marrow, because there's fat, there's adipose tissue, and then the bone marrow, and that's our own. And then what you were just talking about, which would be like the umbilical cord stem cells. So I'm guessing there's different applications for all of these things, different reasons why you would use different ones. And so off you go. I've probably asked about 7 questions in there. Let's start about the mobilization of our own stem cells.
Yeah. No, and please keep me on track, because that is a lot to cover, but I'm your huckleberry there. I'll do it. I love talking about this stuff. So in terms of your own, the word we use is the cells senesce.
Yes.
These stem cells get older and they don't work as well. Even if you've got a brand new car, never been driven, if you left it in the garage for 40 years, it's not going to be the same vehicle as it just came off the lot, right?
Mm-hmm.
So that's kind of the concept here. And of course, if you drove it, well, it's even more going to need some repair. And we are talking about stem cells here. We're not talking about the actual cells. The stem cells can senesce so that the propensity to become another cell and that's needed and work as well diminishes with time. Okay. And you can do things to make it. I mean, I would argue there's a confluence of various things that make it so that your bone marrow doesn't work as well. Those stem cells don't work as well. Any sort of insult to the body, is going to make it so that it doesn't work as well. That whole process, which works great when you're, 3 years old and probably when you're 16, but starts to diminish over time. Certainly by the time you're 26, the argument goes, right? When you've hit supposedly you're fully matured there and you're on the downside at 26, right? You're not growing anymore, at least. So and that one's kind of obvious. So I guess, to spend a lot of time talking about senescent cells, I guess the one thing that we know about senescent cells, though, is that they also contribute to the process even more. So you don't want to mask them quickly. You don't want to mask them at all. But I use the example of an untuned car.
Mm-hmm.
Okay. It's spewing exhaust.
Right.
Okay. With more poisons in it that's going to affect surrounding cells. And that's one way to think of senescent cells. And that's why you want to get rid of them. Although there's a recent study saying that there's sometimes is value to these senescent cells, and you're better off even having a broken, a car that's not well enough tuned. But there's always going to be that fine line anyway. So
I think it's, it's funny. Like people have tendency to go absolute, right? Like, I mean, certainly in the biohacking community, people are like, abolish senescent cells. What can I take? I'll take rapamycin and I'll take quercetin. And like, there's the satinib, like that study with that, it's a chemo drug, right? And quercetin showing that it wipes out senescent cells. And, you get people in this community that are like, well, I'm not just going to do that once a week. I'm going to just do it for a week or something. And at some point, understanding that the human body is brilliant in its design and that too many senescent cells is a negative, but maybe there's a function for some senescent cells. And so, as you said earlier, it's the same as with exercise. Like, what's the sweet spot, right? Because based on our earlier conversation, somebody's going to say, well, if exercising is going to drive aging, I'm going to stay young. I'm just going to sit here on the couch and I'm going to hang out and keep all of my stuff pristine, and which is actually wrong, because then you'll just rust. So, it's finding that middle ground. But the senescent cell conversation, cellular senescent conversation, is so interesting in that we want some, but not too much. And I think that's where, there's this space now where there's even a couple of supplement companies that are coming out with a program that 2 days a month you might high dose, and in their case they're just herbals that are like I'm losing the name of what they are exactly. Fisetin, I think, is one of them. But so you high dose it for 2 days. So 2 days in a row, you do your thing and then you move on. And you've probably reduced your load of senescent cells without eradicating a whole population, kind of thing.
Or risking side effects from other things that fisetin might do is the other concept that is part of that. And it's trying to mimic, you mentioned rapamycin, the same concept applies there because of, its effect on mTORC1, which we want, right, but maybe we don't want on mTORC2. So yeah, you're right. And then, without going into it, I promise, but that raises the concept of hormesis, right?
Yes.
Find the sweet spot. So yeah, you're absolutely right. And so, yeah, you can expect to find some of these studies that contradict the absolute one side or the other, and you got to find the sweet spot. And that's what I believe. We were talking about waking up 500 years hence. Hopefully it's 100 years hence. I think we're going to see something like they have in Star Trek, where you have some mechanism that goes whoop and picks up on all this stuff and finds the exact balance of what you need at that moment, rather than some of these prescriptions we write.
Yeah, I think we're getting close to that. I think we're already, like, there's hints of it in the world, right? And a lot of the conversations that I have with people are people looking for technologies or devices or compounds that help the body to come back into balance for itself. like to restore balance. And I think what's really interesting about the stem cell conversation is, okay, past a certain point, your own mobilization of your own stem cells is not going to be enough to undo some of the damage. So that's where we have to go to the next level, and that's the kind of stuff that I think we're going to talk about next. But I think we're also seeing things like PMF, pulsed electromagnetic frequency mats, that seem to be able to help cells to come back to a place where they function better. And if the cell functions better, then everything else downstream is going to work better. It's not yet going to do what a stem cell can do for you necessarily when you really need it. But if we can start raising the bar on what we can enable the body to do for itself from a regenerative perspective, then we're kind of giving ourselves more runway, almost, in a way.
Absolutely. Yeah. I mean, there's so many offshoots that we can discuss from just that line I think you're talking about. Certainly one thing that has to be mentioned is at the far extreme, I always joke, you can't turn hamburger back into a cow.
No.
At some point, any dose of regenerative medicine is not going to cure something that's degenerated too far. I mean, I think we talked about it before the show. I've got 2 replaced hips. I didn't catch it soon enough.
Yeah.
You could argue maybe even if I did catch it, I play too hard and I would never be able to keep up with the degeneration I was doing to myself, with whatever athletics. And so I would just be slowing the process, which has its own benefit. But yeah, then we have to look to other things, in this case, a prosthesis, to replace what we couldn't do the work of with the regenerative medicine. But when it comes to, we've got some supplemental senolytics, we've got some drug senolytics, and that helps cull the herd to find that sweet spot that we're referring to. And in terms of the various choices we have, I'm trying to stay on track now because you mentioned that's where you want to go to. You do have, for the autologous, meaning your own stem cell production, you've got you can get your body to produce more of them through a drug called filgrastim.
Mm-hmm.
It's used in and of itself. You can say, okay, body, we need some work from the bone marrow. We need those stem cells to be produced, and you could just inject them with filgrastim. Or we can do it to initiate more production so that we can collect them. We can harvest them through various methods. You're going to push more into the paravasculature of the fat so that when we do a liposuction, we can collect those mesenchymal. It's a certain type of stem cell from the fat, and then we can store those. And what's really cool about those is we can also replicate them. We call it expanding them.
Right.
And commercially now we have a process. American Cryostim is a company I work with on their medical advisory board. They were replicating it 30 times when academia was saying, no, you can only do it 6 times. That's proven. No. And so
and is that safe?
genie, oh, absolutely. Yeah, no, it's all done with, GMP standards and yeah. And I've used it multiple times. I could tell you stories. I won't today, I'll spare you, but on myself, my patients, stuff that's, I include in the book we were talking about earlier. I call it miraculous. I mean, stuff that we just never dreamed would happen. Well, we would dream it. We wouldn't think it was practical.
Exactly.
But you can, to talk about the genie in the bottle. I mean, you get one collection and you get 30 different, P naught all the way to P29 expansions. So those cells just keep on paying back. That's one method. The other method is after you use the filgrastim again, you can collect these cells through apheresis. Think of a dialysis machine where you're taking blood from one arm, spinning it down, in this case, to get the right cells you want, and then putting the rest of the blood back in. That collects all 3 stem cell types. You can't expand those as yet, but they're your cells. You can bank them. Should you need them down the road, they're there for you. And then, as you mentioned, from bone marrow aspirate, you can usually get, 12 to 15 million. You can't expand those either because those are, all 3 cell types. And the problem with that one, I would say that's probably the least favorite because, you'll feel like you fell off your bike for about 2 weeks.
Yeah,
and you're
no,
getting a fairly low number of cells. And then for the allogenic cells, we call them, the ones that are not autologous, that aren't yours, we can go to the best form is really umbilical cord tissue cells.
Mm-hmm.
And there's something called Wharton's jelly, which contains the highest concentration. But again, we're not necessarily convinced it's just about harvesting the stem cells. It's also some of the things I mentioned, the
The
exosomes
exosomes.
and the
Yeah.
other cytokines that are also in the surrounding area and the tissue that come with it. They'd also have a lot of benefit. So the beauty of that is that we don't have to put you through a procedure, right? I've got athletes in my practice. Where are we going to find the fat on you, dude? Or dudette? You know, that's an issue. There's some people that say, well, not only that, but I wouldn't want the procedure anyway, or I'm going to fatten up for that. I spent my whole life staying in this shape. And so that's just not going to happen. Apheresis might be a deal killer for people too. Anyway, any number of reasons where they don't want to go through a procedure, but we have them down the hall in the freezer because we've screened properly pregnant women's tissue and made sure, through third-party testing, that not only is it safe, but it has the amount of cytokines, RNA, other growth factors in there that we want before we use it on a patient.
Yeah. Yeah, no, it's come a long way. So based on this new ruling in California, now it's not only okay to use stem cells, but it is okay to expand them as well, because I know that was a massive sticking point, and it's part of the reason why a lot of people will just hop on a plane and go to Mexico or to Panama or to wherever to have their stem cell procedures done, because down there they have no issues with expanding stem cell populations. Whereas in the US, I think for the longest time, it was completely no go.
Well, the issue wasn't so much the expansion of the cells themselves. And it gets a little complicated because you've got the doctor and you've got the laboratory and you've got
Right.
shipment of the cells. So interstate travel, but you could expand them all day long. And so I kept using the vaser to do liposuctions and collect cells, as well as the apheresis machine here, so that you would have them banked. And I didn't touch on this earlier, but I have to mention it now just briefly. The reason for that is, again, the advantage of your own cells is they'll engraft. They'll go right to where it needs to go and differentiate right then and there. They don't have to contact the bone marrow and have a whole process going there.
Yeah.
But the younger they are, when you collect them, the better they're going to work. You're getting that car off the assembly line at 10 years, 20 years, 30 years, whatever, instead of 60 years.
Right. So your age comes into play in terms of the quality of your stem cells. So that's where you're going to go with the allograft cells, like from the outside.
Similarly to think of a female's eggs. She carries them with her essentially most of her life, right, until she runs out. But they're not getting manufactured on the spot. They're stored and released little by little. And so as she gets older, those eggs become less viable.
Right.
Similar concept with the stem cells, right? So you want to get them younger. Yeah, that's an advantage to collecting them, and then we call it banking, storing them at roughly 180 below in nitrogen.
Yeah.
And then have them when you need them. So the issue was, you can do all that you want. You just can't send them back to the doctor and have them infused or injected in this country. Whereas everyone else in the world, except for the UK and Australia, Thailand, you go to Thailand, you go to Costa Rica, you can go to Cayman, and have it done. No problem.
Yeah.
And with efficacy. Japan.
All right. Okay. So let's talk about what we can do with these beautiful little cells. So whether you harvested them when you were young and had the foresight and the resources and found the place to do it and now have access to them. So let's say, I would imagine even harvesting your stem cells in your 20s and 30s would be pretty all right, as long as you're living a pretty good life. And now let's say we're 50 or 60 or even older. What can we do with these stem cells?
Well, just let me throw in one more thing. One of the reasons why you want to collect your own umbilical cord tissue, not if you're a newborn, but if you're the parent of a newborn, you're getting them for that newborn at the earliest stage you can get them, and they can be stored, that cord. And with that cord, that's a lifetime supply of stem cells for that child. So that's where we can start that early.
So that's the best case scenario. That's our best case scenario.
Yeah. what we can do with them, I won't say it's wide open, but it pretty much is, just due to the nature of what stem cells can do.
Mm-hmm.
Again, they're all about regeneration. So whether it's, any organ, skin being one of them, right? We can treat it from the inside or the outside. We can use stem cells topically. We can use, in the case of stem cells, I want to be more clear. We bandied that term about, but the whole collection of cells and chemicals that come with those cells is what I'm really referring to. So topically, are you going to get a stem cell to go into the skin and replace another one? Probably not so much as what comes with it, the cytokines and other growth factors that will help the skin regenerate the tissue. That's what I'm talking about. But from the inside, certainly you can. You can infuse them. And one of the beauties is, let's say you infuse, let's call it, 50 million cells. Those will expand within the body. And
Mm-hmm.
so the effect can be, say, 3-4 times that over the course of 8 weeks or so. So it's not just the 50 million cells you injected, it's what they turn into, because they may replicate into daughter cells, we call them, multiple times before they finally stop generating more cells.
More
Okay, and then
progeny.
that's the end of
Yeah.
the yeah. So what else can we treat? I mean, one of the things that's very interesting to me right now, we've been working on, the NFL has a big problem with concussions, right?
Uh-huh.
And I think it was $73 billion worth of lawsuits have been filed. And it's a lot of money, even if you're the big NFL. You can treat concussion after the fact, post-concussion syndrome. We're about midway through what we call an IND, an investigational new drug trial, where we're treating people with concussions and damage therefrom with infused autologous stem cells derived from fat. And of course, we're getting what every other country's gotten with amazing results. If someone is concussed and you infuse them within 72 hours, now this is based upon rat studies, but they're very demonstrative. With rats, we can open up the skull and see the lesions of the brain. We can see those treated and those not. We can also do tests of their skills through the maze, all that kind of stuff. 100% recovery with the rats that were treated, and of course all kinds of messes and non-functionality, as well as continued brain lesion with those that weren't treated. So we're trying to
But
go
you're
ahead.
saying within 72 hours. What about someone who's had, because again, the NFL is filled with these people and the world is filled with people who have had concussions and are dealing with post-concussion syndrome years later. Are stem cells still able to help out there, or do you have to
Oh,
really get it
absolutely.
right away?
What I'm talking about within 72 hours is 100% recovery
Yeah.
from the concussion. With the post-concussion, post-traumatic brain injury is what we call it, but post-concussion syndrome also, that's something that absolutely helps. And we can talk about the plasticity of the brain.
Yeah.
You're not going to restore scarred tissue. And I think that's part of the reason why you want to get it to within 72 hours. So it knows to replace a damaged cell rather than a dead cell, if you
Mm-hmm.
will. Although it can also fill the void in a dead cell, because the surrounding tissue says, hey, next door to me is supposed to be another cell, fill that in.
Right.
But if there's scar tissue there, that can be difficult to do, obviously, right? So, but with the brain, we used to think it was hardwired. Now we realize it's soft wired. It's very
Yeah.
plastic. So you can reroute some of these features, functions, whatever you want to call it. And absolutely, we see recovery from unfortunately, very large deficits from, they're not just NFL players. There's
Oh no,
military
anybody. Yeah.
and hockey. I mean, you can name sports, but anyone in life who gets concussed can have some pretty serious post-concussion deficits.
For sure. No, I mean, look, it's athlete, and it's athletes and someone who's been in a car crash, or somebody who took a bad knock on the head, or like, I mean, whether it's because of greater awareness, or there's something in the world is making people more susceptible to brain injuries, and like I said, maybe it's just awareness, but there seems to be this thing where it's become so much more common than ever before. Like, I know that when I was a kid growing up, nobody talked about concussions ever. And I mean, I smacked my head on the skating rink learning how to figure skate many times. Nobody ever came over to look at my eyeballs and say, "Oh, you might have a concussion. You better spend the next 3 days in a dark room." Like, you know what I mean? And
Right.
it hurt. Now, it could have something to do with some of the quirks of my personality. Who knows?
Well, and not to go too far into that, but what happens, we're finding out, is that while there might not be any acute deficits, essentially there's a possibility that you're digging into your reserves so that
Mhm.
when you're 80, hopefully 120, whatever it might be, that if there was damage, that's when it expresses, because you run out of that, I'll call it your reserve.
Yeah.
And that's when you go, oh boy, I wish I would have, could have, should have,
Yeah, I think I'm going to have to come see you one of these days. I actually have an aunt who died of Parkinson's a couple of years ago. And my mom always talked about the fact that as a 5-year-old, she had fallen out of a second or third floor window and smashed her head. And this is going back way back in Morocco, let's say 65 years ago. And so, probably somebody put a bandage on her head, maybe gave her, like there would have been no advanced care of any kind. And she went through her life, whatever. And out of 7 kids, the only one that developed Parkinson's disease. And you
Yeah.
have to wonder sometimes, could it be that this brain injury that she sustained as a child created, almost like a weak link or a weakness in her body? And then maybe she was a big gardener. And I've always thought that there could be a link with pesticides and herbicides being a negative influence on the body. And so could it be that all of these things kind of stack up and then it shows up relatively early in life as a neurodegenerative disease that everybody's wondering, well, how did that happen? And you kind of, these are the things in life that maybe we'll start putting those pieces together over time.
Oh, definitely plausible. I would argue you just piece it together. There's nothing that doesn't make sense about that. And with the initial injury to the area of the brain called the substantia nigra, yeah, that could just set the wheels in motion, and the other things. And it usually is, I would say,
Hmm.
more often than not, as I mentioned earlier, a confluence of different things that cause this, not just the one, unless it's really gross,
Right.
and
Yeah.
that normally you would notice it acutely, not necessarily chronically down the road. So, yeah, what you just said is very plausible.
Yeah. So let's talk about one other aspect. So obviously, so stem cells have massive applications. They can, and when they're used, and I know, lots of the people in my community will go in, they'll do a stem cell, well, not lots, but some will do a stem cell IV for kind of like this whole body rejuvenation. They'll have stem cells injected into their joints and this, that, and the other thing. What do you do to prepare the body? Because one of the things I've talked about with people, and I believe, is that if you're in a state of inflammation and you're inject a bunch of stem cells into, you've got massive inflammation in a joint, you inject stem cells. I liken it to sending the Renault crew into a burning house. Like, the house is not going to get fixed. And so you're laughing. Is that a good analogy or a bad analogy?
Well, I'm laughing. I mean, I'm laughing at your analogy, but actually, it's actually the other way around,
Is it
because
really? Okay.
one of the contraindications for, first of all, harvesting stem cells from the body using apheresis, for example, the filbert stem that we would use to get those cells into the bloodstream from the bone marrow, it will not work if you've just done a course within the last 90 days of any sort of corticosteroid, which
Oh,
would reduce
interesting.
inflammation. This is what's so beautiful about stem cells, is they know what to do. They're going to the fire. And as a matter of fact, they do it with priority.
Mm,
So, and again, this is all based on what we know so far. Uh, they're going to go to where the fire is the hottest and where there's more damage going on. And without that as a homing signal, they don't know. And so you actually, I'm not saying that you should let yourself get into any sort of disarray and an inflamed condition just to make the most use of your
yeah.
stem cell infusion. They'll know where to go and still stay as pristine, we'll call it, as you
As
can.
vibrant. Yeah.
Yeah, but certainly don't treat the inflammation prior to it. That would be the wrong way to go with something strong like a corticosteroid. But stem cells know what to do. Now, if you've got a bad knee, that's one of the beauties of it. Is, for example, this is a quick offshoot, but platelet-rich plasma. and
Yeah.
the therapy therefrom we've been using for quite a while longer. And those are aggregating your, not stem cells, but some of those other factors we talked about, the cytokines,
Platelets.
the growth
Yeah.
factors that send signals. I like to combine those two, umbilical cord tissue cells with PRP, because you're getting a little bit of your own plus some of this newborn cell, because the PRP, the growth factors, take a long time, typically roughly 8 weeks before you're going to see a pretty good benefit from their use alone. But because of the very strong anti-inflammatory effect that you can get from umbilical cord tissue cells, you'll get someone who gets immediate relief roughly 2 or 3 days from that, and then through both of them, the long-term benefit after about 8 weeks. So yeah, just to, because we're talking about inflammation, another beauty of it, it's not going to work like a cortisone shot, which is strictly an anti-inflammatory, but it can work fairly similarly depending upon the injury very quickly.
Yeah. So yeah, that's really interesting, because I've always thought that, I mean, and I wasn't thinking cortisone shot at all. Like, I think that cortisone shots are, I mean, look, sometimes you need it to get somebody out of a really bad spot, but in general, they tend to be more like long-term, they're more harmful, right? Like,
Well, that's been a subject of discussion for a long time. The analogy I use is a rubbing compound. So you're going to, when you use rubbing compound on a car, you're going to shine up the vehicle. The paint's going to look better. But what's the mechanism? Because you're taking off the top coat of paint and revealing what's underneath it.
Yeah.
The same with cortisone. You're getting rid of the inflammatory products, but in the process, you're also damaging some of the good tissue.
Right.
And that's why a lot of physicians have said, I remember growing up, you get 3 cortisone shots. Some would say 3 cortisone shots in your life, and that's it. Well, that's not the case at all.
Yeah.
Cortisol actually is something very close to that. It is something that we all need to survive. Without it, you're dead. So it's not like it's a super bad thing. It's just when used in excess, you are reducing the inflammation, but you are doing some robbing of Peter to pay Paul. So you don't want to use it in excess and too frequently.
Right.
And of course, if you have the choice between that and to your point, there's some cases where that's all you can use.
Yeah.
They're usually an emergency situation or close to it. But if you have a choice for the long haul, you can get the reduction in inflammation and heal let's say the joint capsule or whatever it might be, and you're regenerating. That's an easy choice, right?
Yeah. No, well, I mean, it comes down to dollars and cents for a lot of people, for sure. But
yep. Right now, I was going to say that's probably the biggest factor at this point, because a cortisone shot may be a couple $100, whereas stem cells or the stem cell products, you're probably starting at a couple $1,000s.
Yeah. No, and I mean, look, I mean, I think sometimes if people did the math properly in their heads, as long as they had access to the money, you can make the math work. I think from a value perspective, from a amortization perspective, it's, like I bought this great mattress, and which probably cost me, I don't know, 4 or 5 times more than most people will pay for a mattress. And people look at me going like, are you insane? Including my husband, actually. and I'm like, think about how much time you spend on that mattress. Think about how many years it's going to last you. Divide it by the number.
You are absolutely preaching to the choir. I'm not going to tell you how much I paid for mine, but it was a king's ransom, and it was worth every penny.
Right? I'm just saying. So anyway, and so, yeah, so for stem cells. So, okay, so let me go back to my first question then. Do you ask your patients to do anything to prepare for their stem cell infusions or injections or treatments?
No, only in preparation for a harvest.
Okay.
There's the filgrastim I mentioned, but also there's a product made from a cat's claw. It's a derivative of cat's claw called AC11. Essentially, it's another senolytic, and I'll have them on it for a month. I have to share, Dr. GM Papa was the one who introduced me to that. He's I think a plastic surgeon by specialty, but has gotten into anti-aging, and I think written more than a few books. But that's one thing I definitely, you take something of value from everybody. Hopefully,
absolutely.
Right? But there's plenty of research showing that that's a good tool, so that when you do harvest, you're harvesting the best cells you can get. You don't want to harvest senolytic cell.
Senescent.
Senescent cells, right?
Yeah.
That's kind of defeating the purpose. You want the best you can get, and let them get old on their own. Don't further the process any more than you have to. So that's really the only thing I can say. A month before harvest, I would have you take this substance called AC11.
Right. And just to bump it up. So would you do a course of senolytics to maybe reduce the senolytic load and then do the AC11 to kind of boost production? And might that add up to a better harvest?
Well, you could use any other senolytic. I mean, I would argue that that's what AC11 is doing. It's also doing some repair to the damaged cells.
So would you say that there might be value in addition to doing, it's the AC11, right? To increase the release of stem cells. So would there be, and maybe you already do this, or maybe there's a reason not to do this, but would there be any value to maybe do a course of senolytic to maybe reduce the senescent cell load and do the AC11? And that way you've kind of cleaned up territory a little bit, plus you've pushed extra stem cells? No?
Yeah, no, actually, that's exactly what I'm saying.
Okay.
The AC11 is not the substance that's increasing the stem cell count and production. That's something called filgrastim. That's a drug.
Oh, right.
Is the brand name. But the AC11 is for just that. It can repair some of the damaged cells, but also, if the cell is damaged enough, it's a senolytic, and that's exactly what it's for. Yeah, to cull the herd, so all your harvesting is the strongest, the best of the best.
Nice.
Absolutely, yeah.
Love it. Okay, well, there were so many topics in your topic list I wanted to explore, but you know what? I think what we're going to do is we're going to save some of those for next time. Is there anything else about stem cells that you think we should talk about before we kind of wrap up? Because it's such an exciting area, right? There's so much.
Well, the only thing I would suggest is that with the technology we have right now, and I think it's going to change, so that with some of the work we're doing with some of these guys that are pioneers in anti-aging, we're going to find a way to make older cells younger. I believe that and $5 will get you a Starbucks cup of coffee. I don't have anything on the table that shows we can do it. We have some evidence that it's possible, we believe, when you connect two mice together, the old mice, the young mice experiment. So we think that we could take, my 60-year-old cells, if we harvested them today, and make them 20-year-old or less cells. So better, we can rebuild that 40-year-old car, okay, and get it, so it's right off the manufacturing line. But in the meantime, it's a good idea to harvest cells as soon as you can. And you mentioned affordability. Yeah, as soon as you can, go through the process, whether it's apheresis or preferably, I would argue that the best way to do it right now, really, if you want to cover your bases, apheresis and a lipo. So you're getting the mesenchymal cells from perivascular fat, because the apheresis cells you can't expand, but you get all three types. The mesenchymal cells you can expand. So that'd be ideal, but get them while you're young so that you have them banked and stored. If God forbid you have an accident and need them, or just, hey, now I've got my younger cells that I can pace, once a year or twice a year, myself with an infusion, to keep myself younger.
Yeah. You keep mentioning three types of cells. What are the three cells? Because I'm sure somebody is listening to this going, Nat, why aren't you asking what the three cells are? We have mesenchymal stem cells.
Well, you've got endothelial cells, the cells that work on the vasculature. You've got hematological cells, the things that make the precursors to blood, and then you got the mesenchymal cells, which are precursors to fat, bone, and cartilage. But the interesting thing is, I'm not so concerned about the their nature from the get-go. It's their expandability, which is most important, I think, at this point, practically speaking, because mesenchymal cells you can expand, and so you get more juice for the squeeze that way. Whereas the other cells are great, but what's really interesting about mesenchymal cells, as I mentioned, they're precursors to typically for fat, cartilage, and bone, but we find they're very mutable.
Yeah.
So that you can use them for, like I said, you can use the mesenchymal cell for cardiac myocyte.
Yeah. For heart tissue.
That's
Wow.
fantastic.
Yeah.
Or pretty much any other thing. When you get into nerves, particularly like spinal cord, then it gets a little bit dicier, and we have to do more iterations and choose the right beginning cell. Again, for now, because of practical reasons, that's all the technology that we have available to us, and the protocols have to follow certain things. Hopefully it gets much easier, and we could broad stroke it a little bit better. But anyway, that's for now, and it's always changing. So
Right. Love it. And okay, I have two more questions for you. One is, and maybe I should ask this one, the one I was going to ask second, I'll ask that first, and then I'll ask my second one, my first one last. Are you seeing applications for stem cells also with people with chronic diseases? Like, we're talking a lot right now, we're talking about aging, which some people could argue is a chronic disease. We're talking about aging, and we're talking about acute injury, right? Like whether it's a stroke or a traumatic brain injury, or, joint, which is not as acute, but let's say it's degenerative. But what about, are you seeing applications for stem cells at all in people who have, like, I'm seeing a lot of people with things like EBV or chronic Lyme or mold, and they seem to have all these crazy symptoms that can affect them neurologically and cognitively. Is there any application for stem cells in that world that you know of right now, or do you think that's something we might see in the future?
Absolutely. You've got, this is actually, stem cells make up what we call the Buffy coat. That's, those are your white blood cells. Those are immune cells. And I've got two favorites. What got me into this to begin with, back in somewhere around 2011, one of my patients, and I can say his name because it's public record now, David Lyons, who has multiple sclerosis, came back from Cayman and said, Rand, he had a lot of dysfunction on his left side. He says, my sight's better, my gait is better, everything's gotten better since I got treatment. And I said, what? I mean, I only read about this. I thought it was, stuff that was coming down decades. And I said, long story short, I called the president of the company. I got on their medical advisory board. I simply said, look, whatever you want me to help you with, I'm in. And It's led to the fact that, I told you, I'm a investigator in one of the post-concussion syndrome studies now, and we've done a lot together, and it was just, that was the start of so much more to come. One of my favorite stories is a gal who I think at the time was 25, diagnosed with juvenile arthritis, and in a wheelchair, just miserable. You can look it up online. I tell a little bit about it in the book, but it's a really good story it's a happy story because it comes with a happy ending. She got several billion cells, not all at once, but over the course of treatment. And this is an immune disease. This is a chronic disease, right? The classic picture of her on the beach, jumping up in the air, right? Arms and legs outstretched, fully recovered with that treatment. That's the stuff you just go, this is a miracle. It's not a miracle. Obviously it's science, but it feels like that because here was a person we had no answer for. We just had palliative treatment, and at best it made her just slightly above miserable, in terms of the physical damage. She had a great mindset, obviously, but yeah. And there's plenty of stories like that. I mean, from, I was thinking of one where, he had a spinal cord injury and the guy was supposed to be, on a ventilator the rest of his life. They gave him some stem cells in the spinal cord, pre-differentiated, and he's not back to 100%, but, they show him lifting weights, and he can, work his computer, obviously, stuff like that. I mean, those are things you go, wow, that's night and day difference in terms of a life of just not so good versus wow. I mean, things could have been better if it didn't happen, but in the case of the juvenile arthritis, she's 100%, so to speak.
Unbelievable. And do you think it'll stick? Or do you think it'll, for the juvenile arthritis person, do you think those results will stick, or do you think she'll need more stem cell treatments over the years, or you don't know yet?
I have not followed up with the story recently. She's not a patient of mine, but my guess is that more than likely, unless we do a stem cell transplant, which has been around since the 70s, right? where you're completely erasing the immune system and starting over, more than likely she'll have to keep doing infusions. Big deal.
No, no, I mean,
infusions, right? No, I'm just making the point. I mean, like, okay, so unless she does a complete, stem cell transplant.
Okay, no, that totally makes sense. Okay, last question. How old is too old to harvest your own stem cells? Or does it depend on the person?
Never too old. Of course, it always depends upon the person, what you're going to get out of it. But the argument is, I mean, just like the concept with PRP, if you have to concentrate or if you can concentrate them and put them where you want, you've facilitated a process you're trying to facilitate, healing a joint. Now, if you're talking about infusing them, even then, you're accelerating the process. The body's not so good at mobilizing the stem cells. One of the problems is breakdown in communication. Certainly, you start running low on stem cells in the bone marrow. But again, one of the factors that makes it not as efficient is the signals, the communication, the RNA we were talking about earlier doesn't work as well. And say, hey, like I said earlier, wait, works over here. We got a problem that needs fixing. So you just facilitate. You mobilize the cells, you harvest them however you want, and you say, now we're going to step it up again. So never too late.
Love it. All right. I love that answer. You're, as someone once said to me, you're as young today as you're ever going to be. So now's the time. All right.
I agree.
Rand, why don't you tell us a little bit about the book that you have coming out, which will be out by the time this podcast airs, and how people can reach you if they're looking for the magic juice.
Sure. The book is called Cheating Death, The New Science of Living Longer and Better.
Nice.
Available on Amazon. I'm sure it'll be available in the regular retail outlets certainly by the time this comes out. And then our website is www.psrmed.com. So that's Papa Sierra Romeo Michael Echo Delta.com. And hopefully there's a lot of information that's useful there too.
I'm sure there will be. And are you on any social media, or you must be far too busy to do those kinds of silly things?
When you say, I'm embarrassed because I was pretty hip when I was younger to this sort of thing. My dad had an old Osborne computer, which was one of the original ones. And I took logic and computer stuff in 7th grade. But nowadays, man, you saw me, I was fumbling around with Zoom earlier today. I don't, it's not just time. I don't, well, maybe that's, I'll say, yeah, you're right. It's the time, but
it's time. You don't have time for these things. You're far too busy. It's all good.
I do Instagram to answer the questions that they tell me I've been asked, and ditto for whatever it is, Twitter and Facebook and LinkedIn. Are those the major ones?
So LinkedIn's is more of a professional kind of B2B platform, and then the other ones are more consumer driven. So I would imagine
I guess the answer is I have them and I answer questions on them, but as I'm given them by someone who knows how to operate the system, I don't.
Nice. Yeah. All right. So it's psrmed.com is the website, and then Cheating Death, excellent title for a book.
Got your attention, right?
I got my attention. I'm like, I'm all in. I'm pre-ordering that baby. So Dr. Rand McClain, thank you so much for being here tonight. It's been a pleasure, and I hope that we get to talk again real soon.
I hope so too. It's been my pleasure, and thanks for having me.